to S. Peterson. S. Peterson.
Mr. Chairman, this is Dr. Hodkinson. I just want to let you know I'm standing by.
Oh, okay. Well, we would love to hear from you. The floor is yours.
Thank you very much. I do appreciate the opportunity to address you on this very important matter. What I'm going to say is lay language and blunt. It's counter-narrative, and so you don't immediately think I'm a quack. I'm going to briefly outline my credentials so that you can understand where I'm coming from in terms of knowledge base in all of this. I'm a medical specialist in pathology, which includes virology. I trained at Cambridge University in the UK. I'm the ex-president of the pathology section of the Medical Association. I was previously an assistant professor in the Faculty of Medicine doing a lot of teaching. I was the chairman of the Royal College of Physicians of Canada Examination Committee in Pathology in Ottawa. But more to the point, I'm currently the chairman of a biotechnology company in North Carolina selling a COVID-19 test. And you might say I know a little bit about all of this. The bottom line is simply this. There is utterly unfounded public hysteria driven by the media and politicians. It's outrageous. This is the greatest hoax ever perpetrated on an unsuspecting public. There is absolutely nothing that can be done to contain this virus, other than protecting older, more vulnerable people. It should be thought of nothing more than a bad flu season. This is not Ebola. It's not SARS. It's politics playing medicine, and that's a very dangerous game. There is no action of any kind needed other than what happened last year when we felt unwell. We stayed home, we took chicken noodle soup, we didn't visit Granny, and we decided when we would return to work. We didn't need anyone to tell us. Masks are utterly useless. There is no evidence base for their effectiveness whatsoever. Paper masks and fabric masks are simply virtue signaling. They're not even worn effectively most of the time. It's utterly ridiculous seeing these unfortunate, uneducated people, I'm not saying that in a perjurious sense, seeing these people walking around like lemmings, obeying without any knowledge base to put the mask on their face. Social distancing is also useless because COVID is spread by aerosols, which travel 30 meters or so before landing. And closures have had such terrible unintended consequences. Everywhere should be open tomorrow, as was stated in the Great Barrington Declaration that I circulated prior to this meeting. And a word on testing. I do want to emphasize that I'm in the business of testing for COVID. I do want to emphasize that positive test results do not, underlined in neon, mean a clinical infection. It's simply driving public hysteria, and all testing should stop unless you're presenting to hospital with some respiratory problem. All that should be done is to protect the vulnerable and to give them all, in the nursing homes that are under your control, give them all 3,000 to 5,000 international units of vitamin D every day, which has been shown to radically reduce the likelihood of infection. And I would remind you all that using the province's own statistics, the risk of death under 65 in this province is 1 in 300,000. 1 in 300,000. You've got to get a grip on this. The scale of the response that you're undertaking, with no evidence for it, is utterly ridiculous, given the consequences of acting in a way that you're proposing. All kinds of suicides, business closures, funerals, weddings, etc., etc. It's simply outrageous. It's just another bad flu. And you've got to get your minds around that. Let people make their own decisions. You should be totally out of the business of medicine. You're being led down the garden path by the Chief Medical Officer of Health for this province. I'm absolutely outraged that this has reached this level. It should all stop tomorrow. Thank you very much.
Well, thank you for that. Again, hopefully all layers of government are listening. We have the least amount of influence, but we definitely appreciate everything that you just had to say.
I put out that video yesterday because it's obvious that things are rolling out. Hence the name of this, the rollout. People just don't get the urgency of what's occurring. They're in denial. They have normalcy bias. A lot of people just don't understand how serious this is. I'm not saying you all don't. A lot of you do. But I was kind of directed to some things that people were saying yesterday on other channels and in other places about how I interpreted what the general said. And it's obviously that a lot of their language was cloaked, but then they admitted a lot of things too, like the multiple vaccinations and some other things. And you hear the the guy from Moderna talking about it, and you hear the general, and you hear the moderator, and it's troubling if you understand, if you don't have blinders on. This is a logistics general. What has won America its wars when they've won, but what they're known for isn't even fire and maneuver, their tactics on the battlefield, not even their strategy. What's taught in the Command and General Staff College, almost more than anything else, I mean, you get all of those other things, but logistics is the key to winning wars. And Americans, out of all of the countries in the world, have become the very best at logistics. What's logistics? Getting the supplies that are needed to the battlefield, having lines of communication, having lines, supply lines, logistical lines. And there are different types, and I'm not going to get into all the details. But that's one thing that the American military has become extremely efficient at accomplishing, is logistical supply. When President Trump put General Perna in charge of this, a 4-star general, I called him a lieutenant general, 3-star the other day, he's a 4. Put General Perna in charge of this, red flags went off. First of all, what's the military being involved in this for? And the way it's presented is it's because they are so good at logistics. Remember, Trump said in a very powerful way. Well, that's true. I just explained it. The American military is the very best at logistical support. So it makes sense that Trump would do that if he wants to get the vaccine out. Okay? The problem is that, and I explained the 5-paragraph field order, the 5-paragraph operations order that's used in the Army. A lot of people worried about his General Perna's use of the word execute or execution. And that's nothing more than just go. It means go. It means go do it. Execute means start, go do it. It doesn't mean to hack somebody's head off. That's not what it means. It's a military term that means go. As a matter of fact, as I pointed out, in the 5-paragraph field order, operations order, there's a section there for execution of the concept of the operation. The concept of the operation is how the commander envisions the operation going, and the execution is telling them when and how to execute, how to do, how to act. Okay, so it has nothing to do with killing people. Well, of course it does in wartime, but the word execute just means do, go. What I talked about with this general, he was obtuse and used a little obfuscation in one regard, and he didn't in another. And the point that people got upset at me was when I said it's going to be given to every American within 24 hours. Well, look at his semantics here and understand the logistical superiority of the American military. I have not seen the operations order, and yes, there is one. I can guarantee you there's an operations order, and it spells everything out. Okay, and there's a part of it in the concept of the operation that's called the commander's intent. What does the commander want to be the end result of all this? When he said, 2 or 3 weeks ago, when he gave that interview that first sent the red flag up for me, he said, when we received the order to do this from the president, the emergency authorization, we'll be able to move within 24 hours. The whole process will begin in 24 hours. Okay? I'll give you that. That's not what he said yesterday. What he said yesterday was that once they get the order, they will have it to all of America within 24 hours. Big frickin' difference. You might think it's a semantic thing. I'm telling you it isn't. Okay? Now the big question was, are they going to come door to door? Well, that was not my intent to tell you that that's how they're going to do it at first. They can't reach every individual American. People had said that's impossible. We're right, but you're missing the point. The point is that you need to take this with a sense of urgency that they're moving on you. It's like what I was trying to impress upon you is that if you're in a battle and you have a probe on your right flank, a forward element, let's say, even something more serious, a forward element of an enemy combat force that's coming on your right flank, and you concentrate on that, it's called a diversion, because the main effort of the enemy is now going to hit you on your other flank. So it's a way to disarm you, to tell you the way he phrased it, because they know that people are going to resist it. We've already talked about that. People that follow my channel, I figured that they might know what I'm talking about here. They don't want to come door to door. First of all, they couldn't possibly do it in 24 hours with every single American. That's obvious. Okay? I mean, they're going to go to every bayou cabin, houseboat in the bayou of Louisiana, or every little house in Appalachia, every little ghetto, every hot, no, that's obviously not how it's going to happen. And we've told you that. We've said it'll roll out as an opportunity at first, but that there's a hidden threat behind it. And that hidden threat, everybody should know now what's coming. That you're not going to be able to go to the grocery store, like the masks now. You're not going to be able to go into government buildings, fly, travel, get food, get a paycheck. If you're on government assistance, they're already talking about it. That if you're on government assistance, that unless you get the government assistance being like government housing, that kind of thing, that they can force you to get the vaccination. Why? Why in a disease that's 99% survivable? Actually, it's over that, across the spectrum, a little less for people over 70 with comorbidities, other health problems. By and large, why are they pushing it? Because it's more than a vaccine. This is an attack on your person. This is no different than the enemy coming and firing bullets, bombs, artillery, chemical weapons at you. That's what this is. That's why I am so adamant that we must address this for the emergency that it is. They're coming for you. So if I had come out here yesterday, first of all, it got me angry. It definitely did. And I'm not going to discuss the semantics anymore of this. But the Trumpsters out there were the ones that really attacked me on this. And the reason why they did it was because Trump has disarmed them. It's like I've said for a long time, the left, the evil has the leftists, the Dems. They have those. They're not working on them. They had to bring Trump out here to pretend to be your savior, and he has done everything but be your savior. As I said, he's been your champion, but he's really your executioner, and we're seeing that roll out right now. We're going to see some other things happen here. He's going to appear as a savior again, a real savior, in my estimation, and some others. I'm not going to get into Revelation or Daniel today. I'm not going to do that. But he's going to appear as a savior again, and really, really powerful. And most everybody's going to fall for it. Did you notice what the Dems did? Cuomo, Kamala Harris. We're not going to take Trump's vaccine. Man, that's bad stuff. That'll do you damage. That might even kill you. They've done that the whole time. They've attacked Trump all the time. What's the natural reaction of the Trumpsters, the Trumpites? Oh, I'm going to take the vaccine. If it comes from Trump, it's okay. Isn't that what happened? So rather than sounding the alarm, the Trumpsters, as I'll call them, downplayed my emergency message yesterday. Now, before I read these things, let me tell you, when you look behind the scenes, I had somebody tell me, well, there's some New Age messages in there and some other stuff. From the general and from the guy from Moderna. No, I'm not even going there. I'm just going to tell you that their intent is to give this to every single American, no matter how long it takes. But they're going to hit this up front. The commander's intent is not just to get this distributed out to the distribution points where the vaccine can be given. They want to push it forward to get as many Americans to submit to this as soon as possible. How do I know that? Because that's how the military works. If you don't go to wherever these distribution points are to receive your vaccine, wherever, you might get a notice on your phone. I don't know how they're going to do it. They're obviously going to use these somehow. If you don't go voluntarily, they're going to approach you and ask you why. And it will be that you are put on a list. And at some point in time, I don't even have to look at Revelation to know this, because they've already written up the SOPs. That's standard operating procedure books, how they're going to do this. A lot of people have talked about the internment camps and the re-education camps. Okay? There is going to be a point, whether it's under Trump or under Biden, because Trump is not your friend. He's doing this because he sees himself as a god of sorts. There's going to come a time when they're going to come for you. And they will come to your house if they can't find you anywhere else. Geospatial intelligence from Jade Helm, all of these things. The lockdowns that we're going through right now are a perfect time, especially in the holiday period. How often of these people that now are defending Trump used to talk about, don't be home on the holidays because that's when they'll come and get you. And now, because Trump is in charge, oh, that's not going to happen. So this denial, this cognitive dissonance, this disbelief that Trump could be behind all of these things, that's disarming to other people. And I will not play that down. I am not going to give, I don't want anybody to come, I would rather them accuse me of overstating the danger than to understate it. Because then I would be responsible for what happens to you. And I don't want that. So you better look at this thing from the total presentation of what's happening. Not from me, I mean from the military, from this General Perna, and specifically also from, looks like we're having some power problems. The entire thing here with rolling this thing out, it's an attack.
Thank you all for joining today's briefing to discuss updates on Operation Warp Speed COVID-19 vaccine development and distribution. Briefing today are HHS Secretary Alex Azar, Dr. Monsef Slawi, the Chief Scientific Advisor to Operation Warp Speed, and General Gustav Perna, the Chief Operating Officer for Operation Warp Speed.
Okay, well, hello everyone, and thank you for joining this update on Operation Warp Speed. Because of President Trump's founding and leadership of Operation Warp Speed,
Because of President Trump's founding and leadership of Operation Warp Speed,
even as we face daunting epidemiological trends around the country, we have reasons for optimism. With Monday's announcement from the Independent Data and Safety Monitoring Board for Moderna's candidate vaccine that it showed about 95% efficacy, we now have two safe and highly effective vaccines that could be authorized by the Food and Drug Administration and ready to distribute within weeks. Operation Warp Speed has accelerated the timelines for delivering an eventual safe and effective vaccine in a number of ways. We made development investments in 5 different vaccines and upfront pre-purchase agreements with 6 vaccines driving drug makers to begin manufacturing before they know whether their products would be successful or not. We've worked closely with these manufacturers to ensure that they have what they need in the way of raw materials, with Operation Warp Speed applying the same skills and that keep the U.S. military supplied to ensure that there are no delays in vaccine production. Because of this work, by the end of December, we expect to have about 40 million doses of these two vaccines available for distribution, pending FDA authorization, enough to vaccinate about 20 million of our most vulnerable Americans, and production, of course, would continue to ramp up after that. We've been laying the groundwork for distribution and administration for months. There are 4 major tasks necessary to get the manufactured product to Americans safely in order to save lives: allocation, distribution, administration, and ongoing monitoring and data work. We've led much of the groundwork for these efforts and covered the major costs. We've paid for the vaccines. We've worked to ensure that administration costs will be covered by private insurers and the federal government through Medicare, Medicaid, and our program to cover COVID-19 costs for the uninsured. So no American will face an out-of-pocket cost for getting a COVID-19 vaccine. We procured ancillary supplies like needles and personal protective equipment and assembled them into kits that we will pair up with vaccine supplies as they're distributed. This overall task is a partnership between the federal government, including Operation Warp Speed and the CDC, and the 64 state, local, and territorial public health jurisdictions that CDC works with on public immunization programs. For allocation, the CDC's highly respected, long-standing Advisory Committee on Immunization Practices will make recommendations to the CDC director about how to prioritize populations for distribution of initially scarce vaccine, and will then be allocating vaccine to jurisdictions on a pro rata population basis. Last week, we reached nationwide agreements to allow administration of the vaccine by pharmacy chains and networks of independent pharmacies that cover more than 60% of the pharmacies across the country. Because of these agreements, states can have us ship product directly to these partners for administration. The vast majority of Americans live within 5 miles of a pharmacy, so vaccination in pharmacies is a huge piece of ensuring easy access to vaccines once they are authorized or approved and recommended for the general public. Using pharmacy networks allows us to expand access beyond just standalone brick-and-mortar pharmacies because pharmacists, pharmacy interns, and pharmacy technicians also provide vaccinations in places like grocery stores. The ultimate goal here is to make getting a COVID-19 vaccine as convenient as getting a flu shot. Thanks to the incredible public servants working on Operation Warp Speed elsewhere at HHS, across the country, and thanks to President Trump's unwavering support of Operation Warp Speed, we have such a bright future ahead of us.
And thanks to President Trump's unwavering support of Operation Warp Speed, we have such a bright future ahead of us.
The safest way to celebrate Thanksgiving this year is at home with the people you live with and through virtual celebrations. Gathering indoors with people who aren't members of your household is a higher risk activity for spreading the virus. Please know that there is light at the end of the tunnel.
We have already started to stockpile vaccine doses, as Mr. Secretary has said, to the tune of about 40 million by the end of the month of December, and equivalent or slightly higher number on a monthly basis going forward to start immunizing the U.S. population that need the vaccine.
Mr. Secretary, and of course, Dr. Salawi, my co-leader, thank you for this opportunity to talk about and focus a little bit on distribution. So first, I just will say it is a large task, but it's a task that we are up for. And we're going to take a whole of America approach. That's why we're going to be able to do this. And we've been working on this now for over 6 months. Since the announcement 6 months ago on May 15th, we literally started planning accordingly. And it is the foundation of our planning started with the great experts at the CDC and it's been extended to the jurisdiction planners so that we have a great collaborative plan on how to execute this together, right? And as the Secretary talked about earlier, we have implemented several mechanisms to allow other organizations inside of America to enable execution. Not one source or one organization will be responsible, but it's the collective group of us that will make this successful. So distribution of the vaccine will be based on fair and equitable availability of the vaccine pro rata to the population. So in other words, population of the state against the available vaccine will be distributed to each state. We have been working these numbers with the states for a little while, and every week that goes by, we are able to create a tighter shot group of the actual numbers and the allocations that will be available to each state as we get going. Distribution will be by jurisdiction. As I've talked about, I use jurisdiction in states, sometimes inappropriately. So let me define jurisdictions, 64 of them, 50 states, 8 territories, and 6 metropolitan cities equal the 64 jurisdictions. We're doing extensive planning with each of these organizations so that we implement their plan, right? So they will figure out where we want the vaccine to be distributed to and administered, and that's where the vaccine will be distributed accordingly. So we want to emphasize following, of course, FDA guidelines, CDC, ACIP guidelines, the governors and the states will figure out the plan, and we are ready to execute in collaboration with their plan as we've been working on for 6 months.
The governors and the states will figure out the plan, and we are ready to execute in collaboration with their plan as we've been working on for 6 months.
Doing numerous tabletop exercises and now extending it into actual rehearsals of how to move the product from fill-finish sites to distribution centers down to actual administration sites. We are making sure, as I said, that it's a whole of American approach.
We are making sure, as I said, that it's a whole of American approach.
So let me pull the string on that a little bit for you. So clearly here in Health and Human Services, the CDC, the cornerstone, are experts that know how to distribute vaccine as they do every year annually for influenza, as they've done for H1N1, etc. Very talented group of people who know all the technical aspects and all the requirements that are needed to make sure that the vaccine, once we have it fill-finished, we can distribute in a safe and effective way. The second step, as I mentioned earlier, is the 100% collaboration with the jurisdictions, making sure that we are integrated and synchronized and ready to implement their plan for a way they want to execute immunization.
100% collaboration with the jurisdictions, making sure that we are integrated and synchronized and ready to implement their plan for a way they want to execute immunization.
Down at the administration sites as they define it. And we're ready to do that because we've been working together for quite a while. CDC published a playbook back in September, and the jurisdictions have been going through the playbook, filling it out. We've been collaborating, and we've been working the plan and the nuances to make sure that every detail is covered. This is the United States of America. This is not new to us.
This is the United States of America. This is not new to us.
And so organizations, of course, starting with Pfizer and Moderna, right, who know how to produce, fill finish, and then begin distribution of the vaccine, right? It's their core competency. Then we're working with McKesson, a large, very large distribution company that knows how to produce or distribute vaccine throughout the entire country, and I'll talk about that in a minute. And then, as the Secretary mentioned, we have collaborated with pharma such as CVS and Walgreens, right? And so that we have already laid out plans and coordinated memorandums of agreement to ensure that we're executing the right way in accordance with the jurisdiction plans. As they direct, we'll execute. So we're bringing this whole of America approach from government to industry, and we're bringing it all together to ensure that safe and effective vaccines are delivered to the American people in a timely manner. The time associated with delivery. We will begin distribution of the vaccine within 24 hours after emergency use authorization is approved, right? And only after the science has determined and approved it accordingly, then we are poised and ready to begin distribution. Distribution will occur from our fill-finish sites, and will go to all 64 jurisdictions that we are responsible to ensure that they get vaccine for within 24 hours. So everybody, every jurisdiction will have access immediately. Upon the initial push of vaccine, which is the quantities of vaccine that are available upon the emergency use authorization, then we will begin a weekly cadence of delivery of vaccine. As vaccine comes off the shelf, as it has been approved and available for distribution, we will distribute it to the 64 jurisdictions. So, initial push, and then continuous cadence of delivery of vaccine to ensure that we rapidly expand the availability to the entire country simultaneously.
That we rapidly expand the availability to the entire country simultaneously.
We are working with jurisdictions to do several things, though, that we need to make sure that we get done as we get closer to final approval at the EUA by the FDA. 3 things that we're working with the jurisdictions that we need to have. First, we must have jurisdictions create good, solid, expansive provider enrollment, right? As many organizations as they want need to be enrolled so that we can expand distribution rapidly to the quantities of vaccine that's available. Only to providers that are enrolled can we distribute to. So they can limit it to a certain amount, or they can expand it so that we can ensure that we're covering the entire country, as the Secretary alluded to in his comments. Very key point. We have made significant progress in this area. We are just counting the eaches of provider enrollments that we need to get done as we get closer and closer to final distribution day. Second, we must have the states go through and sign their data use agreements. This is incredibly important, right, for the new vaccine going out to the American people. First, we must be able to see who got their first dose, where they got their first dose, and what vaccine did they receive as their first dose. Why? Because we must ensure that we can do the same for the second dose of each vaccine that we're sending out. The second thing, and really important, is we want to make sure that we have a good, consistent flow of vaccine out to the American people. And so our ability to track the uptake, the actual administration of the shot in an arm, is going to be essential to us making sure we deliver vaccine on a continuous basis. So really important.
Really important is we want to make sure that we have a good, consistent flow of vaccine out to the American people. And so our ability to track the uptake, the actual administration of the shot in an arm, is going to be essential to us making sure we deliver vaccine on a continuous basis. So really important.
The third thing I would keep the jurisdictions working on is their actual rehearsals in the execution of the plan. We conduct tabletop exercises at this level, right, where all of government and industry and jurisdictions participate, but then we're expanding it now to actual execution down at the tactical level or down in the local cities.
But then we're expanding it now to actual execution down at the tactical level or down in the local cities.
How do we work distribution of vaccine through the CVS, Walgreens, et cetera, at the hospital? How does it actually get received, unloaded, stored, and then administered is the rehearsals we're working. I continually emphasize this when I talk to jurisdictions. It is a great mechanism to check and double check to make sure everything is in place. What we're doing to make sure that that we are ready at this level after working these details for the last 6 months, as I've told the team, 2 things we must have. One, upon emergency use authorization, all of America must receive vaccine within 24 hours, as I said.
2 things we must have. One, upon emergency use authorization, all of America must receive vaccine within 24 hours, as I said.
I think this is incredibly important. Fair and equitable distribution of the vaccine throughout the country simultaneously. There is no haves and have-nots.
There is no haves and have-nots.
It is an equitable distribution, and we are driving hard to make sure that that happens.
And we are driving hard to make sure that that happens.
The second thing that we want to do is make sure that the cadence of vaccine delivery following the first push is routine so that states/jurisdictions can plan for it and account and develop execution of the administration in a routine method so that the population is well informed and that they know where to get the vaccine and when to get the vaccine. And so those 2 points we're driving home as key essential tasks at our level. And so, Mr. Secretary, thank you. I'll pause.
So as we get ready for questions, I just want to conclude the opening by expressing my deep appreciation to Dr. Slaoui and General Perna. You know, whenever I created Operation Warp Speed, I called around to people in the industry, experts in vaccines, and everybody said, the person that you need leading this is Moncef Slaoui, the world's leading vaccine developer with the greatest track record of delivering results. And he has proven that. I met with the Secretary of Defense and the Chairman of the Joint Chiefs, and they immediately said, the person you need leading this effort is General Gus Perna. And it is, the American people owe a deep, deep debt of gratitude to these 2 individuals, as well as the hundreds of people on their teams who are delivering the kinds of results, historic results, that we have seen in the last week. Thanks to President Trump's leadership of Operation Warp Speed, thanks to the world's and America's great biopharmaceutical industry.
Thanks to President Trump's leadership of Operation Warp Speed, thanks to the world's and America's great biopharmaceutical industry,